Barbershop rather than fight each other. So we brought peace. And they've been friends cool since 1980. Maybe 1990, that summer.
I was just so excited.
I think you see. That's pretty picture.
Sometime today.
Yeah, you shouldn't think so. Nah, I did it. Okay.
Really?
That's going to be a couple of Tuesday conversations. Because just sent. She called at 9:20. She got there. She called at 9:18. She had to be there. She got there at 9:30. Oh, we're not going to see it. Patrick put her in there. I'm going to ask him. As long as we get it, and no information was put in at all. They put in her room. They spelled her name wrong. They just did stuff wrong. So I can put it on in 6 minutes. And he was back to the start line.
All right. Good afternoon, everybody. This week right here. On the Cowboys, they looking better than that book. They slip out. So it's okay. Look, I started a lot of stuff across Georgia where one person hit me on the back of the head with a phone. Don't you ever come in this area talking about the Cowboys. But we're going to go ahead and get started. So welcome everybody. I'm Dr. Calvin Ellison, Ellison's Consulting Services. I'm on the board of Georgia Prostate Cancer Coalition, as well as chairman of Community Affairs for the Atlanta Black Chambers of Commerce. So if you would do something for me, at least look over at the person beside you and just smile. That's all I'm asking. I'm asking you a whole lot of stuff, but just give that smile and kind of put an aura out here in the atmosphere as we get ready for something that is so critically important, talking about our health. Before we go any further, I do like to acknowledge our elderly government. So if you will have a word of prayer with me, I'd greatly appreciate it. Our Father, Creator and King, He told us in all of our ways to acknowledge You. We acknowledge Your presence. We acknowledge Your goodness. And we acknowledge Your sovereignty in all of our lives. We thank You for Your presence being with us in this awesome day, this awesome moment in time that You blessed us to have. In Jesus' name, amen. I'm going to get ready to introduce the moderator. I'm going to have to go shortly myself to another meeting, but I do want to say this to everybody. I'm a naturopathic doctor as well, been so for over 30 years, done work in about 7 different countries. And we all know that our number one wealth is our health. If you're not healthy, you can't do this, and you can't do that, you can't enjoy your marriage and your family and so forth and so on. So I just wanted to stir our thoughts about that. And what I've come to realize over the years, one of the best ways to protect my wealth, my health wealth, is through information. And the application of that information that I get, preferably ahead of time. Because I'm really more into prevention than intervention. But hey, we live in a natural world, so we do need the intervention. Then the last thing I want to share, and I'm so proud that you all are here, and those of you listening from whatever social medias, good to see you, Sean. And that is, I really believe that we got to just spend more time focusing on preventing problems than having to get into the individual side. So just want to stir your hearts and your minds down those lines. You do have a folder on the first page here with the agenda. You'll see this QR code where you can put your phone on that, so that way when Dr. Spearman gives his presentation, you'll be able to follow right along with him from what he's already got online there for you. All right, there is one coming behind me, greater than me, whose shoes I'm not worthy to untie. And so I want to introduce the moderator for today, Ms. Crystal Styles Cuthbert, former journalist and TV personality, actor, founder of Crystal Knows Beauty, that you see over there to my right, resident merchant here at the New Black Wall Street Market. On behalf of Todd, let's give him a big hand clap for putting this on today. Doing working with these guys for going on 5 or 6 years. Let's welcome Ms. Crystal Cuthbert.
Good afternoon to everyone. And let's liven up, it's okay. We know we're here to talk about a serious topic, right? We want to save our people, right, and educate. But let's do it with the joy of the Lord. Can we do that? Do one big family. Thank you. Let's clap together. It's all right. We want to make sure we absorb and we feel good when we leave here with what we leave here with. I'm super excited about this program when Todd approached me about moderating. As he mentioned, I have a product in the market. What I did not tell Todd was that I am also an international certified trichologist. Trichology being the biological and scientific study of hair and scalp disorders and diseases. So I've traveled the globe teaching that from an internal, external approach. So I've coupled that with my communications degree to help my people, right? The more we know, the more we're supposed to share and help the public. Well, I'm gonna tell you, I'm not gonna do much talking because this panel is a powerhouse. Can you clap your hands for the panel? And we're gonna start. It's going to be right to left, maybe your left to right. We're gonna start with Mr. Tim. So Tim, let me make sure that it's Tim Brown is his name. Tim Brown, he's with Melaleuca. He's a senior director with Melaleuca. And he's going to give you some insight about his experience. You have a microphone, Tim? Okay.
Thank you so much. My name is Tim Brown. I have been a marketing director. I partnered with Melaleuca 5 years ago, simply because I was introduced to wellness through my mom, who was director of public health in Michigan, and all my life it's been about nutrition and wellness. I tell people she was the mom that put wheat germ on wheat cereal when I was growing up. So that's how I grew up. And with cod liver oil, I thought it was child abuse at the time. But been about wellness my entire life. And 5 years ago, I was introduced to this company, and what I saw from it was a way to remove toxic as a way to remove a lot of the toxic chemicals out of our home. That's what it's all about. You know, the nutrition is huge. We think about health, right? We think about eating better. We think about exercising. But not a lot of people think about the things that we're breathing in inside of our home. Or we don't think about the things that we apply to our skin as it relates to a lot of the illnesses that we deal with. So that's what my look is about. It's about helping us to convert our homes away from a lot of those toxic chemicals that cause a lot of issues. And so you come by the table, sign my paper, name, email, and I can share more about it. Thank you.
Thank you so much, Tim. We really appreciate all of your wealth of knowledge and understanding. Dr. Spearman, can you give, I read your bio a bit, can you give a little snippet of, you know, where you came from? You've been a first of a few things.
I'm Dr. Spearman, originally from Macon, Georgia, and I did my undergraduate studies at Morehouse College, and then afterwards entered the Medical College of Georgia in 1970. It was a unique privilege in that I was among the first 3 African-American students to enter the Medical College of Georgia, and subsequently stayed on to do my residency as a first resident, and then as the first chief resident, and then first full-time faculty member at the Medical College. After 7 years, I yielded to the desire to enter private practice area, and I spent 24 years in solo private practice of internal medicine prior to transitioning to the VA hospital, where I spent the last 11 and a half years of my active practice career. So it's been a reflective career, and very rewarding, and it's a pleasure to be here to share some of my experiences with you.
Thank you. Clap your hands for those women. You know, it's an honor to be in the room with trailblazers in our community, right? When people come from certain eras and we know the challenges from certain eras, things are a lot easier now than they were when people were knocking down doors to be first to do something grand in our community. So we should be very excited about it, to have you here. Thank you so much. Ms. Sylvia Dennis, I also read your bio and I'm inspired. You are a survivor and an advocate. Can you tell your story, please?
Good morning, everyone. My name is Sylvia Dennis Gray. I am a caregiver. I am an Alzheimer's and dementia advocate, and I am a breast cancer survivor. My journey started with my mom when she was diagnosed with dementia. And I've been through a lot in my life. My husband was diagnosed with prostate cancer in 2015. He is now a prostate cancer survivor. Last year, I was diagnosed with breast cancer on Valentine's Day. That changed my life. So I call myself the caregiver that needed caregiving for the first time in her life. So I'm excited to be here. I'm excited to share any knowledge that I have, and thank everyone else for being here.
Thank you so much. We had a privilege of being on a Zoom call, like a pre-prep Zoom call, and it was powerful on that call. You know, I did not expect to hear these passionate stories, life stories, right? Accounts. They're not just stories out of a book. These are their life accounts. Aaron Payton was also on the call, and very inspiring, impactful life story. So you are, let's talk about your survivorship and your advocacy as well. Aaron Payton.
Good afternoon, everyone. My name is Aaron. I'm originally from Chicago, and I am a 3-time stage 4 cancer survivor. I was originally diagnosed back in 2009. And let me back up just a little bit. I also wanted to say too that sometimes people think that cancer has a face. It doesn't really have a face. Can you guys all hear me in the back? can't, I saw you.
You just put the mic closer.
Yeah, so what happened, I was actually working at my company and I had a really bad headache one day. It felt like a needle stuck me in the side of the head, and I just jumped up and I left and I went to the hospital. And they did my blood work and all of that, came back. The hospital called me and said, Mr. Payton, we need to see you, we need you to come in. So I went back and I was dating this young lady at the time, and he's like, well, I have some news to tell you, but do you want me to say it in front of the young lady? I'm like, yeah, go right ahead. He said, well, you have cancer and it's very aggressive. I was 43 at the time, I'm 55 now. And I'm like, what? I have what? I'm fine. He's like, well, we're gonna do 12 biopsies on you. I was like, okay. Now at the time, I don't want to embarrass myself. I didn't know what a biopsy meant, right? So I was like, okay, cool. He's like, you have to bring someone with you. And when I went for my biopsy, I went by myself because I'm like, I'm just gonna be in and out. I didn't realize what that entailed, especially having prostate cancer, right? So I go in the room, and on this table, there is a big apparatus, and there's a bucket of KY gel. I'm like, what is that? What are you gonna do with that? He's like, well, we have to get samples. I'm like, where are you getting samples from? And he's like, well, you have prostate cancer, so we have to. And so, anyway, 12 biopsies, no anesthesia. And I didn't have anyone there. I didn't tell anyone that I was diagnosed. I decided the young lady I was dating. And so, of course, a month or two after that, it was really bad. I don't want to get into that part. But, so they did say it was aggressive, but they wanted me to get another, someone else to look at it just to make sure to verify. So I did that, and they did say, yes, it's aggressive. So I had to go have treatment. So that was December of 2009, February of 2010, I went and had what is called a prostacision seed implant, where they put seeds inside of you, and then they do a beam radiation on it as well. So by them saying mine was so aggressive, they had to put 81 seeds inside of me, and I had to do beam radiation for 3 months every single day for an hour in the tube. And so that was no fun. But after that, all of that happened, I was cancer-free. 2015 rolled around. 2015 rolled around. I was talking to my doctors. I was going to the gym. I was doing all of that. And one of my buddies who I worked with was a natural trainer. So he wanted me to start working out with him. And I took a couple things from my doctor and said, hey, look, here's what he wants me to take, you know, me with my energy and stuff. Am I okay with taking this? And they said, yeah, Mr. Payton, you can take that. You're cancer-free. Start taking it 2 months later. I started feeling funny, went to the doctor. They said, okay, your cancer is back and it's now spread. I said, okay, well, I don't feel any different. I'm a little tired or whatever, but so they say the cancer's spread. And so they started putting me on, they put me on chemo at that time. So I had 8 rounds of chemo, and along with injections, and along with radiation, and along with pills. So I did that for a while. Had to get my knees drained because they kept swelling, and just a whole lot of things were happening. So it abated some. So I'm going to fast forward because it's a whole bunch. I'm not going to get into all of it. I'll be here 2 hours. Fast forward to 2017, my doctor told me that the cancer was in my lungs, and next was going to be in my bones, and I had 12 months to live. So I told my doctor, I said, well, I don't believe or feel that. And he said, it doesn't matter what you believe or feel, this is biology. And I have 3 degrees in heart. And I said, oh, okay. Now, I'll talk how I talk to him. I said, okay, I'm from Chicago. You know, the way you're talking to me right now, the old me, this would have been a different conversation. And so at any rate, I said, I'm going to get a second opinion. And he said, well, you might want to do that. So I went to Cancer Treatment Centers of America, and I spoke with them, and there was a whole team of people that I spoke to. And I felt really, really good. And my first visit out there, I met with my doctor, Mari Taha, and I was in a room and 9 people came in that room, from a nutritionist to holistics to minister to doctor to all these people in there, scribes, and I'm sitting there like, okay, what's going on here? And so doctor came in and said, yes, Mr. Payton, you have stage 4 cancer, but we're going to give you 50 more years. Are you okay with that? I said, let's run that. And so my cancer went into, the cancer went into, the cancer went into remission. And my doctor, he actually, everyone wanted him, so he moved to Miami, and I was fine for a while. Again, and it was really in my lungs a lot. So last year in May, my birthday month, they removed my right lung. And so we did that. And I was asking my doctor, I said, well, do we really have to do that? Can we do some other things first? Like, no, Mr. Payton, it's a cluster, and if that cluster bursts, it's gonna be in your spine, and you're gonna be paralyzed, and blah, 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 blah. I'm still sitting there battling in my mind, like, I don't wanna do this, but they're saying I can be paralyzed, it can travel through my whole body, be in my bones, be in this, that, and the third. The reason I have more concern is because 4 of my aunts passed from cancer, 3 of my uncles passed from cancer, and both of my grandmothers passed from cancer. And so my oldest brother was diagnosed with throat cancer, but he's been cancer-free with his diagnosis, so he's fine now. And so I was like, I gotta listen to this doctor. So I did it against my own will. And once I did that, 3 months later, currently, the cancer is in my liver, in my ribs, and in my lungs. So I was just at a celebration with cancer treatment centers last week. I just got approved for a new procedure that is very, very difficult to get approved for. In all, I've had 21 doses of chemo. I've had radiation forever. I've had pills, I've had injections. I got an injection last week. And the procedure is a targeted therapy where it's going to target the cancer in my liver, in my ribs, and in my lungs. So I start that on November 7th. And I'm excited because it's been shown, it's called Pluvicto, if anyone's ever heard of it, it's called Pluvicto. And it's very promising to have these things removed. Now, I know a lot of you people are looking at me and probably saying, hey, you don't look like anything from him. A lot of people in my family and friends, they think the same thing. And I tell them, hey, look, the exterior may look like a Cadillac, but the check engine light is on. And so, but I'm actually going to a mechanic to get all this stuff. So, I know this has nothing to do with me. This has everything to do with me being able to spread what the goodness is given to me. And I need to share that with other people just to let them know that I have become mentally stronger in this journey because there are nights when you go through a lot of depression, sadness. You could be in a room full of people who feel alone, and you just got to fight through it. So I have a lot of caregivers around me, which are my friends, family, my children, all those people. So I'm excited to be here. I know I went over my time, but there's a lot of stuff that's happened, and I just really wanted to let you guys know, even in the midst of all of this, I know who takes care of me, so I know I'm going to be fine, and I'm not worried about it. And some of my caregivers, or some of the doctors, didn't understand why I didn't show fear. I'm like, well, okay, you're telling me all of these things. And I'm like, okay, what do we do about it? Let's just keep moving. And so that's just the way I've looked at it. I don't know how to look at it any other way. So that's a little bit about my story. Thank you, guys.
Thank you, Aaron. I really appreciate that. You all see, he only gave a snippet on the call the other night, and I think everybody was just quiet. You know, it was very humbling, very humbling. So thank you so much for sharing, because testimonies help multitudes, really. Dr. Roz, Master Herbalist, yes. Can you please introduce yourself and give a bit about your story?
Hi, everyone. I am glad to be here. Let's see. So I am a holistic practitioner. My expertise is in wellness, holistic wellness division. I am also a board certified master herbalist. I just added that to my certification. And so, just in a nutshell, what I believe is that the body can heal itself, but you have to give it the right environment. For instance, if you are full of Taco Bell, Burger King, and McDonald's, your body does not have the right environment to heal itself. But if you eat whole foods, and what I mean by that is maybe some baked chicken, some broccoli, some peas, and maybe a tiny piece of cornbread and water, along with taking supplements and vitamins and minerals, that is a whole food or a whole food type of meal plan that will keep you healthy and keep you well. Some of my clients, so some people will say, well, Dr. Ross, do I have to go vegan in order to be healthy? Absolutely not. About a third of my clients are vegan. If you decide to go vegan, that is a personal choice, but there are vegans that don't eat well either. For instance, Oreo cookies are vegan, okay? And I do have clients that are full of Oreo cookies. And they'll come to me and they'll say, I don't know why these numbers look like this, Dr. Ross. I'm vegan. And so once we start unpeeling some layers, and I find out that they eat vegan cookies, vegan crackers, vegan pasta. So even though they're vegan, they're eating, you have to have a balance, let me say that. So if you're gonna be vegan, you still have to have a balance, and you need to explore some of the plants in the produce section, because that is how you're gonna be healthy. Now, for the rest of my clients, I teach you how to eat meat. Meat has a place in our lives, and it is not king of the table. Where I'm from, meat was king, okay? So basically, you planned everything around your meat. So if we're gonna have steak, we're gonna have the biggest steak that we can have, and then we're gonna have some pasta, and we might have a salad, but the salad is gonna be iceberg lettuce, it's gonna be full of cheese, meat, ham, turkey. So the salad really is not a salad. So I teach people how to clean their diets up. We incorporate some herbs, and we incorporate some type of health as far as whether it's going to be yoga, meditation, stretching. You have to put some type of physical exercise in there. But there is a recipe, which in natural medicine we call it a protocol. There's a protocol for everyone. I have had clients that have healed their bodies from everything from a chronic sinus infection to dementia, Alzheimer's, cancer, even stage 4. When somebody comes to me that has stage 4 cancer, I would prefer it if we could catch it at stage 2 or stage 3, simply because people have become slaves to their diet. And what I mean by that is, even though they've been given this diagnosis and they understand that they cannot eat fried chicken and macaroni and all these things for a while at least, when you tell them that you can't eat that for a while, their mind goes into a tailspin and they may be good for a week or two. And then eventually those old habits will creep back in there. And even though somebody's told them they have 6 months to live, they will find themselves at the Golden Corral at the buffet eating all that they can eat, okay? So some of the work that has to be done comes from the client. So I can definitely help get your body healed, but the rest of that work comes from my clients. So if you know somebody that has been diagnosed with anything, something's hurting on them, they cannot figure out what it is, then they may try alternative therapies, which is alternative medicines. So you can find a holistic person probably just about everywhere. But if you're in Stonecrest, Dr. Ross is here, I'm available. I am not here every day that the market is open because I do consultations from my home office so that I can hear and they can hear me. But I have a number. You can shoot me a text message or you can shoot me an email. So I make myself available because my goal is to help heal as many people as possible.
Thank you, Dr. Roz. I love what she said. That was an icebreaker in itself. We're about to go into the icebreakers, but she said, eat some plants from the produce section. And everyone laughed because she wanted to make sure that you knew that the plants in the store are in the produce section. Praise God. Me and someone I was having a conversation with earlier before we started about Mediterranean diets versus, I think it was Dr. Ellison and I. We were talking about Americanized diets versus like Mediterranean diets. And in America, you know, you're taught the entree is the meat, right? And then you'll get like a spoonful of vegetables. That is the opposite of what we're supposed to be doing. You know, it's really, really crazy. So we need to reteach ourselves and teach our families better, right? So clap your hands for the panelists for all of their wonderful wealth of information. Now you see how important. I wish this room was packed, and I know Todd is we're gonna keep working on this, and you know we'll have to move out of this room eventually, right? On the next time. But if you would go in your packet, we want to go to the Mentimeter. Okay, we're gonna do some icebreakers. And there are a few questions in the Mentimeter. So if you scan the QR code, it will take you to the Mentimeter, okay?
So what that looks like, folks, is there's the agenda, at the very top of the agenda, there's a small QR code. It's right in the front, right there at the top.
At the very top, yes.
And there's also one on the second page, but it's a little bit bigger. If you scan that, that's gonna bring you into what we call it's like a small quiz, but it's an interactive exercise that we're all gonna do together. So if you could just take a couple of seconds and scan that, and it's gonna bring up a question that you'll see there, so then we'll get started. Then everybody kind of give me a signal if you have it.
Does everybody see this when it pops up? Okay. Everyone should see just, I think it's about 3 answers there to one question on the first page. This is fun, isn't it? Technology is awesome at times. So if your Wi-Fi is not on, you may want to go to the New Black Wall Street guest Wi-Fi. In your settings, if your Wi-Fi is blocked or your data plan is blocked, please go to the New Black Wall Street guest Wi-Fi in your settings. You see a much stronger signal to participate. So raise your hand if you have the quiz up. Okay. Give a couple seconds for time to.
Is anybody still trying to connect to the Wi-Fi? Everybody got it? Okay, good.
Yes, New Black Wall Street guest Wi-Fi.
I'm about to bring it up on the big screen.
Okay.
And this is basically a segue into our next speaker.
Yes, our next speaker is Dr. Ronald Spearman. Okay, so he gave you a little snippet earlier, but he has a prostate cancer presentation. So make sure, you know, you want to go to your notes in your phone, or if you have something to write within your packet. We're going to really, really delve into some education. Don't we love education? I love education. I am an educator, but the best educators, the best leaders are the people who study the most. Did you know that? They study the most because they have to be ready each and every day, right, to share and give proper information. So, you know, we cherish our educators. So here's the question. What is the most important step in the prevention of death from prostate cancer? What is the most important step in the prevention of death from prostate cancer? First option is diet and exercise. Second, early detection. A little typo there, but it's early detection. And third, knowing your family history. What is the answer? So we got the high levels up here saying one thing. Anybody want to give a pitch from the audience?
Anybody in the audience want to answer?
Anybody in the audience? Don't be afraid. Early detection. Early detection. Early detection, right? So it's back to what we kind of started talking about earlier, and what was that word? It starts with a P. Prevention. Prevention is the most powerful tool. It really is. And early detection is a very powerful tool to know, about just about everything in life. Early detection. So everybody clicked on early detection and hit submit. Okay. Yes, Dr. Spearman, come on up.
Just yet, but maybe as the resident expert.
Yes.
Maybe you could give us your intake or your input on the answer to that question.
Yeah, the early detection input.
Yeah, I very much agree with that, and I will elaborate on that further as we get into the talk.
Okay. So you got some goodies to tell us about. I figured. I was like, yeah, he has a lot of wisdom. I just feel it. I feel it.
Everybody answer that?
Yes.
We got one more question, then we're going to transition.
One more. And we'll have Dr. Spearman come up. All right, next question. At what age are prostate exams no longer necessary? At what age are prostate exams no longer necessary? Is it 35 to 40 age bracket? 40 to 50 age bracket? Or 50 to 65 age bracket? No longer necessary. All right, can we get an answer from the audience, please? Can someone raise their hand, be interactive right here at the table?
The question is a bit ambiguous, yes. Considering that
It is.
it could be necessary depending on your family history. It could be necessary depending on if you've had cancer before. All these ages are relevant in my opinion.
So there's no fourth prompt that says neither or none.
Agreed.
I was looking for that prompt. I was looking for neither or none. Go ahead.
I would say that that question would be, to me, would be irrelevant because there's always a need to do that no matter how we are.
Health and wellness is important to you, leave here, right?
So I still get, but I'm still getting checked.
Yes. Yeah, so that's good stuff. Clap your hands for the icebreakers. Dr. Spearman, are you gonna come up and take it away? Clap your hands for Dr. Spearman, and after Dr. Spearman, we will have Dr. Roz. She will come up to talk about herbal treatments.
Okay, as the slide, as we're getting the slides available now, I'd just like to reiterate it is indeed a pleasure to come before you, and I represent the Sons of Allen of the AME Church, and that organization is very much involved with a lot of things, men's health as well. And I've given this talk on several occasions. The subject today is, the emphasis today is on prostate cancer. But as I mentioned earlier on, I spent a good portion of my initial career as an educator in internal medicine, and I still hold the title of associate clinical professor in internal medicine. And so it's a little hard to completely divorce myself from the teaching aspect of that. And so in the talk that I usually prepare is about prostate health. It covers the broad spectrum of prostate diseases, prostate issues. But I'm going to go through that somewhat more in a more abbreviated form and get to the prostate cancer segment of that, which is the focus for today.
And I'd also like to express a welcome on behalf of Stan Smith, who is the state coordinator for the Sons of Allen. And ordinarily he would have been here, but he had a death and involved a very close relationship, and he was not able to attend that, not able to attend here today because of attending the memorial service. So we have the first slide, please. The spectrum of prostate diseases includes inflammation, enlargement, and cancer. Cancer is what we're going to focus on today. We move to the next slide. But what I'd like to do, since we're going to be talking about prostate exams and PSAs and that sort of thing, I'd just like to just go over some very fundamentals so that you can have an appreciation for what we're talking about.
Why, may I say why Dr. Spearman is doing something? If any of the panelists want to come out and turn this way temporarily, because I know, knowledge is power. And although, we are learning every day. So anyone who wants to turn around and watch the presentation, and then once we're done.
Well, it looks like it's a laser pointer. It's not the top of the screen. I'll just step over. But as you can see, the brown area right in the middle is the prostate gland. The prostate gland, well, this is actually a cartoon, a cross-section of the male anatomy. The prostate gland, as you can see, sits just below the bladder, and it's about in the normal male, it's about the size of a walnut. Its major purpose is to produce the majority of some of the fluid, which is essential in the reproductive process. You can also see in the red area, just to the right of the prostate, is the rectum, and you can see the proximity of the rectum to the prostate. And this is why when we talk about the digital rectal exam, you can see why it's possible for the examiner to examine at least a portion of the prostate gland, which enables the examiner to detect irregularities in the gland that might serve as a clue to something going on. So I just wanted you to have an appreciation for that spatial relationship. Next slide, please. The other thing is the PSA, and PSA has become kind of a household word now as it relates to men's health. And PSA is basically a protein that's produced in the prostate gland. It's produced in very low quantities normally, but when levels are elevated, it can be elevated in prostate inflammation, prostate enlargement, and prostate cancer. Oftentimes, as the prostate gland increases in size, the PSA may tend to rise, and so all mild elevations of PSA don't necessarily reflect cancer, but certainly an elevation of the PSA is a very suggestive and is a harbinger of cancer and should be evaluated. Next slide. And I'll just briefly mention this prostatitis is just an inflammation of the prostate gland. It tends to occur in younger men. It has obvious symptoms of fever, chills, and tenderness. It usually resolves in people with antibiotics, and this is in the acute phase. In the chronic phase, it happens with persons who have a history of recurrent urinary tract infections. There may not be symptoms, but nevertheless, it does warrant treatment, and this can be adequately handled by a urologist or a primary care physician. Next slide. Prostate enlargement, I would like to mention briefly because prostate enlargement is kind of, I use the analogy, it's kind of like gray hair. Everybody gets it to some degree, some get it earlier than others. And as you can see, this is a depiction of the normal prostate gland, which sits just below the bladder. This is the urethra that passes, the urinary passage from the bladder. And under normal circumstances, there's a good flow. When the prostate gland begins to enlarge, you can see how the urethra becomes constricted, and this is the thing that results in the frequency of urination, having to get up at night, having to diminish stream, that sort of thing, and that can certainly make life uncomfortable, but it can be treated with medication. There are some surgical procedures, as I mentioned, antihistamines and sedatives can worsen that, so you want to have to be careful with that. And this is a fairly common occurrence, particularly as men reach the age of 50 and beyond. The enlargement is not associated with, is not cancerous, but it can cause other problems as a result of the obstruction. And so it's something that, that certainly should be addressed. And next slide. But we get down to prostate cancer, which is the thing that we'd like to place the emphasis on today. Prostate cancer is the most common cancer in men after skin cancer, and it is significantly higher in African American men. The statistics vary to some degree, but I've read in several of the more recent articles, and the incidence in African American men is reported as high as 1 in 4 men developing prostate cancer at some point in their lifetime. Some more conservative journals reported it as 1 in 6. But in the Caucasian population, it's 1 in 8. So we can see that it's obviously something that has a much higher prevalence in African American men, which is all the more reason to be that much more vigilant in the things, in early detection, and the things that we need to be mindful of. And the bad news is that this is the 3rd leading cause of cancer deaths in men. But the good news is that it is very treatable with significant cure rates when diagnosed early. And this goes back to the icebreaker question we talked about. The greatest thing that minimizes prostate cancer deaths is early detection and detecting it early. The options for, well, we'll get into this when we talk about treatment, but again, I can't emphasize the importance of early treatment. Now, when we talk about risk factors, what are the factors that predispose men for prostate cancer? Well, age is one factor, in that as we get older, the prostate gland begins to increase in size, and sometimes this increase can be associated with transitions in cells that were previously benign and subsequently become malignant. And in some of the autopsy studies done where older people were evaluated, and for other autopsies were done for other reasons, and the prostate gland was an incidental evaluation, there was the occurrence of prostate cancer does increase with age, and there have been a lot of instances in which the cancer has been diagnosed just based on the tissue samples without it having any clinical manifestations. So as we get older, that tendency does tend to increase some. But as I mentioned earlier, race is an extremely important factor just because of the statistics. And as I mentioned earlier, in some studies it is as often as 1 in 4 African American men developing it at some point in their lifetime, and that's compared to 1 in 8. So it's, I know another way of looking at the math is that we can say that African Americans are twice as likely to develop prostate cancer at some point. Family history is extremely important, and that was one of the choices about that, and I just want to elaborate on it. When we say family history, we're talking about male relatives. The highest risk would be having a first-degree male relative, and by first degree we would mean father or brother. But if there is a maternal, an uncle, particularly a paternal uncle, this is also an increased risk. And that there are some genetic studies that show that it even crosses lines on the maternal side. If there's a history of prostate cancer, that increases the risk. So it's very important to be aware of that, and we're going to talk in a minute about screening parameters. But if there is a family history, this definitely increases that risk over the 1 in 4 possibility that we talked about for anyone developing that. One interesting thing about some of the studies is that we have had relatively few African American men included in a lot of the statistical studies. Some of the things that are more favorable have been studies that come out of Scandinavia, and we don't have very many of us in Norway, Denmark, and Sweden. So that the data gets a little bit skewed, but as we are getting more diverse now in our academic pursuits and in studies, the information is becoming more and more relevant. There are other factors that relate to lifestyles, smoking, obesity, and these are things that tend to increase the likelihood if there is a predisposition to that. And smoking is not associated with prostate cancer the same way that it is smoking with, say, lung cancer, for instance. But obviously, if there is some predisposition to prostate cancer, smoking, obesity can contribute to that. More recently, Agent Orange has become significant. As I mentioned in my brief introduction, I spent the last 11 and a half to 12 years or so of my professional career prior to retirement, active practice in the VA system. And of course, Agent Orange certainly has come up a lot, and there are a lot of cancers that are associated with that, and prostate cancer is among them. And I'll just throw it out that that is a basis now for service connectivity if a person develops prostate cancer and was in the Middle Eastern wars and had exposure, or the Asian wars and had exposure to Agent Orange. Radiation exposure is another factor. This relates more so to people who who've been exposed to nuclear accidents where they had large doses of radiation. In general, persons who are working in hospitals or facilities where radiation is used for therapy or radiation is used diagnostically, badges are usually worn, and the amount of radiation exposure is monitored closely. So I don't think that's as excessive. But if a person has been in an unprotected environment and exposed to excessive radiation, then that certainly can be a factor. Next slide. Now, we're talking about now evaluations for prostate cancer, the diagnosis. One thing that is, and there are a few things that we're going to go through and have been alluded to early on. One thing that is conspicuously absent in this slide is symptoms. And I did not include that for the simple reason that prostate cancer usually does not manifest any apparent symptoms until it has progressed to a point that's beyond the likelihood of being able to get a cure. If we get to the point of having back pain, or if you look at a list of prostate symptoms, you might see things like back pain, see blood in the urine, difficulty with urination, some weight loss. But the issue is that when it manifests itself in this way, that means that it's already spread beyond the prostate gland itself. And as we've heard, certainly there is hope for managing or suppressing the disease or more advanced disease, but the primary thrust is to be able to detect it early so that we can hopefully control this in a curative manner and not have to deal with the consequences of more advanced disease. So the real focus, as we talked about in that icebreaker slide, is in the early detection. And the early detection includes a combination of the visual rectal exam and the PSA level. The visual rectal exam, as I mentioned, as I illustrated in that slide, allows the examiner to examine at least the bicam of the prostate gland. And in situations where there is an irregularity or hardness or some palpable or feelable irregularity, that certainly is something that raises suspicion and it enables the urologist or evaluator to be more directly targeting the area for involvement. But on the other hand, this is the other half of the prostate gland, and so this is why there is some synergy between the visual rectal exam and the PSA. If we had to only choose one, I would say that the PSA is the most essential, and that's certainly something that is readily accessible. That's a simple blood test as opposed to a clinical examination. And so, but the two complement each other. And certainly, if there's prostate enlargement, the visual rectal exam is helpful there. The PSA should certainly be done. Now, when should we get the PSA? For persons of average risk of not having family members that have had prostate cancer, at least under the age of 65, the upper limit is at age 45. certainly it doesn't, I would not object to having it done earlier. But for persons who are at a higher risk, that is, having had 2 or more family members who have prostate cancer diagnosed at the age of less than 65, should have their first screen at age 40. And it really doesn't help. It doesn't put things to have any African American have that screen. The reason is that, as I mentioned in the first slide, the PSA normal range goes from almost 0, very low, up to 4. 4 is considered the upper limit of normal. But the PSA range varies, the acceptable range varies from age. In other words, 45 to 50-year-old might have a PSA of 1 or 1.5. But if that person has a PSA of 3.5, which is within the range of normal at that age, that is our concern. And so we have to look at the relative values of the PSA. The second thing is that, component is that we also have to look at the rate of rise of the PSA, what's called, what in medical terms is called PSA acceleration. And what that means is the PSA should not rise more than 7/10 of a point per year. So that if your PSA is 1.5 this year and 3.2 the next year, that's still within the normal range, but it has decreased too rapidly. And that would be a basis for further evaluation. Now, in terms of the of how long should you measure PSAs, the American Cancer Society a few years ago made a recommendation of well, I've seen it published in 2 different areas, either 70 or sometimes 70, 75, I think. At the VA hospital, where I was last employed, they adhere to a guideline of 70. In the patient population that I managed, everybody had to have an annual examination, and of course, there being 99% there in that examination included comprehensive lab data that included the PSA. And the recommendation was that by age 70, we no longer need a PSA. The premise was that prostate cancer at that age and beyond would tend to be a relatively slow-growing, a relatively benign process, and the chances are the person would succumb to something else other than prostate cancer. But in the 45 years or so that I supervised and directed and coordinated the prostate cancer in my practice as an internist, I saw predominantly adult patients and lots of adult males. I would have to differ with that significantly because as a person gets to the age of 70, relatively unscathed, good health, not having to have a stroke, heart attack, and good health, the life expectancy actually increases. As you get, if you're at age 70 and in good health, the chances are pretty good that you're going to make it to 90. And so I've had the experience of having managed too many patients who have reached that point but have had prostate cancer later on and have had to undergo some rather arduous treatments because in their 80s or so because of advanced disease. So I think that it's really prudent to continue to be screened as long as you feel that you're able to accept some form of treatment. So I think that it should be a very individualized decision as to how often, to what age, but I certainly don't think that arbitrarily one should stop screening at that age. I think that I routinely extend my screening, have extended my screenings to any age where the person felt that they would want to know and would be willing to accept treatment for them. So the digital writing exam, the PSA are important. There is a version of the MRI scan that is very helpful now. It's called a multi-parametric MRI scan. It's not available everywhere, but I would certainly inquire about that. The MRI scan, using a special technique, enables one to evaluate irregularities in the prostate, and this particular protocol grades the irregularities from grade 1 to grade 5. And the grade 5 is basically prostate cancer to prove it otherwise. And that's very helpful in terms of trying to make a distinction between borderline PSA elevations, and also it's helpful to the practitioners in terms of correct the bias. And then, of course, once the suspicion is raised based on the elevated PSA level, possibly an MRI scan and prostate biopsy is done, as has been described earlier. And the biopsies are usually done depending upon the ultrasound, and typically 12 to 18 biopsies done. And fortunately, they recognize now that some sedation is needed now. And it's generally an outpatient procedure. There are a few instances in which a certain type of assessment of biopsy, called a saturation biopsy, is done, and that might require enough sedation to be in a day surgery center. But generally, it's a fairly benign process and not debilitating. And most people might take a day off and work for the next day and go back, but it's certainly the appropriate thing to do if there's a level of suspicion. Next slide.
I think that's all the slides.
Well, is that what? We should have a treatment. That should be a management. One more slide. Now, once the diagnosis of prostate cancer is made, there are usually basic approaches that are used. There's one called watchful waiting, and or another terminology that's used is called active surveillance. And I kind of had mixed feelings about this. What this basically means is that a diagnosis of prostate cancer is made in the biopsy. The decision is made to postpone definitive treatment. Well, let me just back up. The diagnosis is interpreted as a cancer of relatively low aggressiveness. And by the way, when the biopsy is made, there's a scale, it's called the Gleason scale, which basically rates the aggressiveness with which cancer is thought to in the body. And there's a lower level and an intermediate level where some people feel that one can delay surgery or radiation in terms of for a very period of time. And if the cancer does not show signs of progression, then that may obviate the need of having surgery or radiation, which may have their consequences. The problem with that is that prostate cancer, in addition to being more common in African American men, it tends to be more aggressive in African American men. So I think that if one accepts that course of management, that we have to be very, very careful to make sure that the PSAs are being monitored extremely closely. Up until the last year or so, I was very skeptical of that, although I've more recently been in contact with some African American urological cancer specialists, and who, in the right situation, have endorsed this watchful waiting or active surveillance for a period of time. But I think that this should be done in a cancer center by someone, by a urologist who is a specialist in managing urological cancers, and so that the appropriate parameters can be done. There may be reasons that one would want to postpone surgery or radiation, but again, I think that the evidence now is showing that it may be appropriate for some African American men, but it should be done in a very specialized setting so that it can be actively managed. This is anecdotal for anybody, any academicians that listen, not statistical backed up, but I've just seen instances in the VA system where a person was diagnosed 1 year with what appeared to be fairly well localized cancer that's contained in the gland, and that active surveillance went on, was embarked upon, And because of a missed appointment or some other misadventure, the patient came back a year later with evidence of lymph node involvement, which basically picked it up to a higher level. So I think I would be very careful with that. Surgical options now include predominantly robotic assisted surgery. This is state of the art now. 20 years ago, prior to that, the options with the surgery included what was called open radical prostatectomy. In my private practice, I advise patients who were in their mid to late 60s or so that this was the consideration. Radiation was the first line of treatment. The open surgery was very involved surgery, involved a big incision from the belly button down to the pubis. There was almost always sufficient blood loss to require transfusions. It was a big procedure, but in skilled hands it worked. And I've had several patients who had good outcomes with that. However, the more recent laparoscopic surgery or robotic assisted surgery has been a huge game changer in that. And I've had patients who are over 70 who've been doing that procedure very well. It's done under magnification. The structures are seen much more clearly. Problems with incontinence, erectile dysfunction are greatly reduced with that. And it's certainly something that can easily be done. In fact, during the pandemic, there were a couple instances where younger patients who were healthy had this done on a day surgery basis, although in most cases you spend 1 or 2 nights in the hospital. But it has really revolutionized that. Radiation certainly can be effective if you speak to a radiation oncologist, a person who specializes in radiation treatment, where they will quote some very favorable statistics. And as has been stated earlier, radiation can be done in 2 phases: the implantation of seeds, and combined with external beam radiation. And if it's done and the detection is early enough, that can be effective. There are certain cure rates with that. And with the recent years now, the radiation has gotten much more sophisticated in terms of being able to deliver it much more precisely with a lot of less collateral damage. Surgery has the risk of some erectile dysfunction or some bladder incontinence. It probably offers, assuming that the prostate the cancer is contained within the gland, it probably offers a greater degree of greater likelihood that the cancer is removed in its entirety. Radiation has the advantage of being not as invasive, and there is not any recovery from surgery. Again, when it's properly administered, there is significant evidence of cure rates with that. I'll just mention one thing with surgery. If there is a recurrence, you can always retreat that with radiation. With radiation, you cannot go back and do surgery, or it's very difficult to do that. So that's one thing to keep in mind. But the surgery should be done in a center or in a facility where there is considerable expertise, where they do 20 or 30 a month rather than 1 or 2 a month, because that has a lot to do with the effectiveness of the outcome. And in instances of recurrences, medical management has really come a long way now. In my early days of residency training, the medical management basically involved testosterone suppression or deprivation. That was done either through administration of estrogens, female hormone, which had its share of side effects, although it did help, or castration, which is basically moving the source of testosterone. But now chemotherapies have been developed that can be effective, and also on the horizon, well, not on the horizon, but available now, but in limited supplies, is immunotherapy, where that drugs can be administered that actually target the cancer cells themselves. This is becoming available now. At least it started in Germany and Europe about 2 to 4 years ago, but now it's reaching the mainstream. So there is hope in the case of recurrence. But let me just mention this one thing. I know the time is getting important. Prostate enlargement and prostate cancers are very much influenced by testosterone levels. And this is why I mentioned earlier that some of the early treatments pertain to minimizing testosterone. There are a number of ads that you see in the media now talking about the testofen and testosterone boosters, that sort of thing. That should be viewed with the jaundiced eye, particularly for people who are in the age range where prostate enlargement or prostate cancer is a risk. Prostate cancer is very sensitive to testosterone, and anything that increases testosterone levels, whether it's taken by whether it's testosterone itself, which it's kind of hard to do that. That's a very skillful drug, or some things that augment or increase natural testosterone levels should be, I personally think, should be avoided because of the risk of that. If there's latent prostate cancer, it can certainly accelerate that. True testosterone deficiency is a diagnosis that that should be treated. It should be handled by an endocrinologist or someone who has expertise and skills in doing that. If a person is truly deficient in testosterone, that does have some adverse consequences in lifestyle. But the object is to raise that level to the very lowest level of normal to minimize those effects, and not to get this super level and become the super jock that's advertised on television. I think that's misleading. I think for us, African American men in particular, I would not recommend that. I think that would be ill-advised. Well, that's the scope of what I want to present now, and certainly I'll be more than happy to entertain questions or discuss it further as time permits later in the course.
Thank you, Dr. Does anyone, I actually have a question, but does anyone else have a question? I'll let someone in the audience go first. Your name?
Chris James.
Chris James.
How you doing, Doc? Amen. Thank you for that. I feel smarter because of you. So I read in I attended another event a few months ago, my wife and I, and one of the doctors, he spoke about the importance of, he talked about prostate cancer, but he talked about the importance of ejaculation for men. And I also read about it in men's health. Ejaculation for men to prevent prostate cancer. Can you speak on that a little bit?
That has been mentioned, but we don't have good scientific evidence that plays a big role. Basically, what happens is that the seminal vessels, which are the vessels that contain the prostatic fluid in preparation that can be distended. But I think that's something that's more likely to result in, maybe some interference with urination and the emptying of the bladder. But we don't have strong evidence that has a carcinogenic effect. That's not in the mainstream literature.
Thank you.
Dr. Spearman, can we talk a little bit about one of the categories of those who are most likely? So we remember you had race on the board.
Yes.
And I want us to talk a little bit more about what that means, because African Americans are always on the high list of most things. What does that mean to us? Does it mean just because you're African American, or does it mean because we have certain habits within our community? We're exposed to certain things because we're Black. What does it mean, race itself?
Well, there appears to be some genetic predisposition for that in terms of having that, the likelihood of developing that. Now, lifestyles and those factors really relate more so to the severity of the disease, and that has to do with not being detected early. We tend to lag behind in terms of getting screened. So in that sense, lifestyles do play a role. But I think that is, that the current studies do show that there is a genetic predisposition as well.
Thank you so much. Because there are things that we can do, right? This is our pharmacist, Robert Peterson. That's a question.
I heard somewhere where it said that men who had melanated men, there was a predisposition because it was blocking UV light. So it didn't make sense to me, but I heard that somewhere, and it was from a Caucasian position. And the relationship of your absorbing of getting vitamin D from the sun. Is there any validity to that?
I'm not aware of that. Now, when it comes to melanin, I think that has been speculated that might have some protective effects against skin cancers because of blocking some of the UV rays as opposed to fair skinned persons who more likely to absorb the UV light, the ultraviolet light. But I'm not aware of there being any relevance of that as far as prostate cancer is concerned.
Thank you. Yes, ma'am.
Hello, Dr. Sturban. I did a question regarding studies that are conducted, and we as African Americans do not participate in studies that are conducted. And I'd like for you to give me some suggestions on how we can encourage African Americans to participate in studies.
Well, I think that's a very significant deficiency overall, and several articles have brought out that point that we're lacking in studies, and I'm not aware of all the gateways, but certainly I'm involved with the research at the Medical College of Georgia, and there is the Georgia Cancer Center does reach out. I suspect the Winship Cancer Center here at Emory is involved with that too. But certainly, if there's any evidence of prostate cancer or any predisposition to that, I think that the cancer centers would welcome to do that. I didn't state in any of my introduction that I have a unique sympathy and empathy for prostate cancer because I'm a neophyte survivor myself for about 4 years. And so, my management was done surgically through the Georgia Cancer Center in Augusta. And just by being engaged, I was approached by the Winship Cancer Center, and I have come part of that study. So I think that the gateway is probably through the urologist. They have a more proactive in terms of recruiting people for that. But if there's any invitation to participate in a study, I think it would certainly be helpful. It may not have any immediate impact on one's treatment, but it certainly contributes to that database that reflects how the cancer affects African American men.
Yes, ma'am.
Dr. Spearman, I was a caregiver for my uncle who passed away at 90, nothing to do with prostate cancer. But when he was about 80, his PCP told me that there was no need to perform prostate exams anymore. And in my ignorance, I just went along with it. So my question is, when one gets to that age in your late 70s, 80s, maybe even your 90s, does the risk decrease for our race at that age?
I don't think the risk decreases. I think the severity of that decreases. I think for a person who, if it doesn't manifest itself until the 80s or 90s, I think that it's probably a relatively slow growing tumor. I think the real concern is for the person in their 70s and their early 70s, because that's the point at which now screening has been declared as not necessary. And so there's look at it now. You go 60 is the new 50, 70 is the new 60, that sort of thing. And so I'm an automotive enthusiast. I guess that's kind of my advice. one of the few things I have, and I love Porsches, and I've already put my children on notice that for my 90th birthday, I want a new Porsche. Amen.
Great. Well, thank you so much for Dr. Spearman's enlightenment, education, wealth of knowledge, right? His wisdom and his personal experiences. And thank you for your questions, your dialogue here at the symposium. We are going to next have Dr. Ross, who is a master herbalist, to come up and talk to us about prevention. She gave us some goodies earlier, didn't she? And she was funny while she was doing it. So hopefully she'll bring a little bit more of that. And then after Dr. Ross, we will take a break, all right? And if anyone needs water, we do have water, okay? So if you like water, let us know. And just raise your hand, we'll make sure you get water to your table. At this time, Dr. Ross.
All right, how's everybody doing again? Okay, so I am not going to keep on. I'm going to start. Stopwatch. Okay, so holistic medicine. What is holistic medicine? Holistic medicine, Hippocrates is known as the father of medicine, and Hippocrates said, "Let food be thy medicine, and medicine be thy food." So one of my mentors said that, genetics loads the gun, but environment and lifestyle pulls the trigger. Now, what do I mean by that? So, for instance, if your family has a history of high blood pressure, diabetes, high cholesterol, things of that nature, things of that, oh wow, okay, this is the real mic right here, okay. Things of that nature, then so you may be predisposed to those things, but what happens is if you continue to have the same lifestyle and eat the exact same way that your mother and your father and your aunts and your uncles ate, that is pulling the trigger, right? Because you can change all of that. So there is two lists when it comes to food. There is an alkaline side and there's an acidic side. So acidic foods are everything that we love, okay? So we're gonna talk about that one next. The first thing we're gonna talk about is alkaline. Alkaline is nuts, berries, fruits, vegetables, seeds, water. That is it. That is all that's alkaline. Alkaline is the way to keep your body healthy. Now, acidic foods are everything else. Sweets, rice, pasta, bread, macaroni and cheese, ribs, meats, whatever it is, sodas, sweet tea, lemonade, that's acidic foods. So the trick is, or the balance is to have more alkaline foods going in your body versus acidic foods. So what I teach my clients to do is something called 80-20. So we want to do 80% alkaline, and I like what she said about the Mediterranean diet. If I had to endorse any type of meal plan, it would be the Mediterranean one because it's whole foods, it's mostly fruits and vegetables with a little meat. They mainly consist of chicken, fish, things of that nature. And they may have beef, but it's only going to be 1 or 2 times a week. So it's a very healthy way to eat. So you can look that up if you're interested in Mediterranean. But the number one food that causes cancer, can anybody take a guess at what the number one? Sugar? Okay, all right. So sugar it's up there, but I'm looking for a food, something that we love. And it is typically something, I'm sorry, what now? Meat, okay, steak. So it's actually donuts. Yes. So the reason why it's donuts is because it's a twofold thing. It's fried and it's laced with sugar, right? So donuts are the number one cancer-causing food, okay? Coffee actually paired with a donut is the worst thing in the world that you could eat, okay? Now, holistically, what we know about coffee is that when you drink a cup of coffee, caffeinated coffee, your body goes into a shock, right? And it is the exact same feeling that you would get as if you were in a head-on collision. So that is the reason why you feel like, whoo, the coffee just, yeah, it is doing some stuff to you, but you don't realize what it's doing to you. So you can look that up, research it further so that you can find out the effects of coffee. Some of the things and some of the reasons that we are sick is really because of ignorance. We just don't know what we need to be eating because we are under the illusion that I'm grown, I can eat whatever I want to eat. I can eat it when I want to eat it, I can do that. But I want to leave you with this tip. Your body needs 4 hours to digest a meal, okay? So if you eat something, let's say you eat at 2 o'clock, the earliest that you need to be eating again may be at like 6:10, 6:30. What we do is we eat something at 11 o'clock, then we get a bag of Skittles, and we get a drink, we get some chips, and we just munch throughout the day. Your body cannot digest your food properly like that. There are enzymes that are inside of your stomach that when you swallow the food and chew the food up, those enzymes help break your food down and digest it. And so some of the times when people are saying that they have leaky gut, they have irritable bowel syndrome, all of these things, it's because of the way that they're eating. And they could be a vegetarian, which is a healthier lifestyle, but it's the frequency of them eating, right? So another thing that I teach my clients is your biggest meal of the day should be breakfast, not dinner. The reason for that is when you eat breakfast, you have your whole day ahead of you. So you give your body a chance to digest that. But if you eat dinner at 7 or 8 o'clock at night and then you go to sleep, then your body is not able to digest it like it needs to. And you're not moving around and helping that to burn off. And so some of those calories that needed to go someplace else may end up in some other areas. And you can also end up with acid reflux like that. But in any case, so just educating yourself holistically, researching and reading is a really good thing. And also, when you're researching something, you want to have a credible resource. Google is not a credible resource. And a lot of people don't know that. When I was, I believe, in the master's program, my first graduate program, the first thing that my professor said is, if you're going to turn in any research paper, if Google is one of your research references, then you have a 0. Because anybody can put something on Google, right? So Google is not credible. You may use Google for maps, but that's it. Do not type in diabetes reversal or high cholesterol or whatever it is. Don't research your health using Google. Use credible references. So that's going to be it. And maybe if somebody has 1 or 2 questions, we can use some questions. If anybody has a holistic question. All righty. Well, I think
Quick question.
Okay, go ahead.
Alkaline, the alkaline water, is that a real thing?
So unfortunately, it is not. Okay? So in this industry of holistic health, there are people doing money grabs as well, okay? Just like the vitamins that you get from Walmart, Walgreens, and stuff like that, you have 10% herb and 90% filler. The fillers are cardboard or sawdust, okay? You don't need to be buying vitamins from places like that because you're really not getting anything. That's the reason why it costs $10 or $12. You feel like you're beating the system because you're like, well, I got vitamin C, I got this, I got that. You really don't have anything. Not really, because it's 90% fillers.
Anyone else? Oh.
Okay, Chicago, okay. So then, you need to find somebody that is an herbalist that can support that for you, or you may need to find an organic herbal company that will supply you with, for instance, I get my herbs from two places. One of them is in South Africa, the other one is in Honduras, simply because you can't trust some of the stuff that goes on here, because as soon as people find out that they can add sawdust to stuff, which I feel like is just outrageous. The very first time I found out about that was cinnamon. The cinnamon in the grocery store is like $1.50, $2, something like that. And so I found out that real cinnamon is so strong, before you open the container, it almost just knocks you out. So the cinnamon that you get in the grocery store, same thing with the cayenne pepper and all of the things that we have, it's mostly fillers, unless you can see what it is. Like for instance, rosemary, you can see that the rosemary is rosemary. So if they can't get us, then they don't. But if they can, they do. When you get a supplement and you break that supplement in half and it's white, that is nothing that you need to put in your body, because what herb is white? There are no white herbs, okay? So if you got a supplement that you're taking and you break it open and it's white, that's a chemical, that is not an herb. Now, I'm gonna tell you how to make your water alkaline. You just test your water. Any alkaline water that you get, tested. You can get a pH strip, you can order it from Amazon, you can get it from Home Depot or Lowe's. Put it in there and test your water. Whenever we have tested water, the tap water is, so if you want to get alkaline, you need to be 7.1 and above, right? Anything under a 7.1 is acidic. The tap water, which is the least water that's healthy for you, so to speak, the tap water was higher than the Sunny and all sorts of stuff that we had. So what I tell people is, don't get caught up on labels of water. If you like the way it tastes, drink it, because most people are dehydrated anyway. So before you start trying to get super healthy in your mind, I'm gonna get alkaline water, but you just pulled up to McDonald's and got a #1 and said supersize it. But that's not how you get healthy. But at the same time, how do you alkaline water? Get you a pitcher of water, right? Whatever kind of water. Take you a tablespoon of Celtic sea salt. Put it in there, shake it up, stir it around. That's your alkaline water. And when you test it, it is going to test at a 9 and above on the alkalinity chart. So that's a free tip for y'all. Go ahead.
What about liquid chlorophyll?
Liquid chlorophyll can be good for you. Turn it over and see what the ingredients are, okay? I always teach people, you are your best investigator. You are your own best doctor, right? Because you know what has happened to you. You know if you get too close to this chemical, if you start being agitated or if you're itching. Yes, there is a place for holistic doctors like myself. There's places for a medical doctor. But you are the one that needs to be in charge of your health. Now, if you have, let's see, your question was, what was your question about? Okay, turn whatever package you have, turn it over if you want to know what you're going to put in your body. If anything on the back of that package you can't pronounce, leave it, okay? Because it's not good for you. It is full of chemicals, it's full of stuff that you don't want in your body. Another thing, what they have done with the plant-based foods, you guys have been seeing plant-based foods. The majority of plant-based foods don't come from plants.
Talk about it.
Okay? The majority of plant-based foods were made inside of a plant. It is a play on words, but guess who endorsed it? We're not gonna name no names, but you know who endorsed it, right? So, plant-based food. So when you turn over this plant-based burger, like that Impossible Burger, flip it over and find out what the ingredients are And you might be surprised. I think I saw one plant on there. I saw like a bunch of things and I couldn't pronounce half of them. And I saw one. If you're gonna make a burger, okay, you're gonna get plants, foods that you know what they are. For instance, the vegan burger that I'm accustomed to is made with black beans, okay? It's got black beans, it's got red peppers, it's got onions, it's got celery, it's got stuff that you know what it is. There aren't any new foods, okay? So if you flip over that package and it says blah 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 blah, you don't know what that is, and I don't know what it is. Put it back. They are playing on our ignorance, and we gotta stop it.
And the FDA.
Dr. Ross, can we grab the question?
Yes.
More information about tilapia.
Yes.
Oh, canola oil.
Canola oil? Canola oil is bad for you. Tilapia, so what happened with tilapia was some foreigners found out that they could grow tilapia. I have tilapia, I've grown tilapia before. They found out that they could grow tilapia and they reproduce really, really quickly and they can make a lot of money from it. And there was a time a few years back where everybody was doing tilapia. So if you get your fish from a farm-raised type of situation, you need to make sure that it's not overcrowded. Okay, that's the problem with the same thing with salmon. So Publix and Sprouts have their own homes, right? And you can taste the difference in a piece of fish that is being taken care of and they're cleaning it like they're supposed to versus what I like to call a dirty piece of fish, right? You can just taste the difference. Same thing with grass-fed beef. If you've ever had grass-fed beef versus regular beef, you can taste what's not in there, right? So it's just a cleaner cut of meat. They've just done better by taking care of the animals, and that's what you're looking for. So tilapia is not bad for you, but probably if it said China, put it back.
Okay, we'll take one more question, maybe from someone who hasn't had an opportunity to ask a question. Is there anyone who hasn't, okay, in the peak? And then after this question, Dr. Ross answers it, we're gonna take a 30-minute lunch break. You can patronize the vendors in Aaron's Market. You can visit the vendors here as well. We'll have about 30 minutes to do that, okay?
When it comes to alkaline water, can you put lemon, what's the other thing, the green
Lime.
in it? Does that alkaline?
That helps, and that's gonna raise the pH some. But if you really want it to be alkaline, to really do something, you're gonna have to put some Celtic salt in it. And Celtic salt is very hard to find right now because of TikTok. So people are on TikTok spreading information. Now some of it is true, but most of it is not true. You have 16-year-old herbalists on TikTok telling you how to cure cancer and how to cure all sorts of stuff. And people actually are listening to them. And whatever these people are saying, they run out and buy the stuff. So about 5 months ago, I was at a health webinar and I was in Marietta, and I just wanted to see if the trend had got that far. Sure enough, Sprouts, Whole Foods, that's the only place that you can get it from. If you don't order it, they said they're out of it and they don't know when they'll ever have any more. Social media is very, very powerful, okay? So it's out all over the world.
Thank you, Dr. Ross. Thank you. This is the real one. Yes. Thank you, Dr. Ross. Compliments for Dr. Ross, Master Herbalist. As I mentioned, we're getting ready to take a break. I do want everyone also to know that Oak Street Health in the back, wave your hands. They're doing blood pressure screening back there. So if you'd like to have your blood pressure checked, please see the vendor Oak Street Health in the back. We also have Crystal Knows Beauty, beaboutselfcare.com with nutritional supplements. We have, I want to make sure I'm saying it right. Is it Jen, the Senior Medical Center in the back also. We have Melaleuca vendor also on the side. So please walk around, check out the vendors. You can go in Aaron's Market and patronize the food vendors in there. And we have about 30 minutes to do so. Okay? Thank you so much. Okay, and you see Miss Brittany right here, right? She has her glittery hat. She can escort you to Aaron's. When you get your food, you can also come back in here to eat, okay? So enjoy the 30-minute break, and we will return with more great education. Thank you. Daylight.
Knocked it over. Process going on.
Yeah, I think it's food.
Oftentimes we'll see someone in office, PSA or C6, which is clearly abnormal. But then from prostatitis to suspected, we will treatment, which is of course an antibiotic. and the PSA drops down to maybe 4 or drops down to 3. So with a declining PSA in the function antibiotic almost always implicates prostatitis rather than prostate cancer.
Yeah.
Prostate cancer, if you treat the animal, it's not going to make a difference.
A lot of my friends came on the phone, he said, man, he was so glad he was not dealing with this cancer. You know, he said, man, I told him, he was 0.1.
That's a great thing anybody.
Yeah. So I am glad. I try to explain to my baby about it. So I don't really have to count for free, but I have. It's not it, but not direct, but it is direct.
Well, I mean, there are a couple caveats to that. Are you taking any?
I take Cipro. I took all of them, but they really don't want me to take Cipro a lot.
Cipro has some baggage. I mean, it can cause problems. It has to get seizures, it can cause some mental problems, it can cause tendon ruptures. Cipro is not
500 milligrams. That's what it's
not a benign drug. But a couple things about the low PSA. Now, when you take these medications for prostate enlargement, I said there's one drug that's called there's a drug that's called Prostate. It's PR. Are you taking it? I mean, you're not going to advocate to take it, but the reason it's PR.
Are you taking?
I mean, are you not advocating? I'm just asking you to take. The reason I ask that is that Prostate is one of the called the American finasteride. The trade name is called Prostate. The reason I say that is that Prostate is a drug that's commonly prescribed to reduce the size of the prostate for people who are having difficulty urination and that sort of thing.
But you don't have time.
Right, because of the problem. Because prostate, it reduces the PSA reading without reducing the risk of prostate cancer. So, you double the PSA.
No, he's not advocating it. He was asking you if you were taking it.
Because I was trying to reconcile this very low PSA with this prostate.
Right. Yeah, that's why he was asking you.
The other thing is that, I mean, that's one caveat. The other thing is that most prostate cancer is associated with rising PSA, but there are few prostate cancers that do not have elevated PSA. So I think that, now, are you being told about the urologist?
I'm giving you because I had an appointment with this guy, new guy, and normally, maybe this can feel like it. I thought he was going to check my rectal, plan, so he didn't do that. I thought when you do, I thought you normally do it,
Well, you normally do that. I mean, as I said in the talk, you had to only select one choice. I did the PSA.
Well, I did the
But the competing exam includes a rectal exam, because if you had a lump or bump in the prostate, and even PSA was rectal, that would be suspicious, and that would be something that you want to evaluate.
My doctor retired, he knows me good, Dr. I really miss him so much, but he retired like you. And so I got this other doctor, and he said, no, I'm not going to check him, so he
Well, I was with him probably for 45 years. And of course, I've been out there for about 15 since I left the VA. But after the medicine, it's all used to be.
Okay.
I'm going to the restaurant.
Okay.
Yeah, I still see a lot of my former patients who are around. They complain about the doctor walks in the office, backing out. Not talking.
He said, you know we won't get dirty. He come in and talk to me, it's me. He tell me, whatever. And I said, the doctor, if I'm taking my pants down, so he can, no, I'm not going to do that. said, well, what's going on?
It's a new breed.
Yeah, I said, wow, you know, because my old doctor, that's all he was doing out there, you know. And he would give me, you know, matter of fact, I need to look up, I did a 6 year, took the scope and look up in there. You think I should get that?
Is it Solonoscope? Colonoscopy?
Yeah, exactly. Yeah.
Well, yeah, colonoscopy should do that now. The guidelines have changed a little bit now. If you have average risk of colon cancer, you don't have family history of colon cancer, or you don't not have polyps before. If you get a clean exam now, they'll give you up to 10 years, usually 5 years. But if you had polyps before, if you have a family history of colon cancer, then you probably should be on a 3 to 5 year schedule.
Let me ask you this, and I'm going to go. A couple times, I feel like I'm going to the bathroom, and my feces, before I get to the bathroom, it comes out, you know. So I'm telling people I have a loose flu. I need to get that checked too, because that's, I was thinking about that, like last 2 nights ago, before I could sit on the stool, it started almost coming down, you know. Yeah. And so I don't know if it's something I did that a couple times, but I said my bowels should be something like that, you know.
Well, how long has it been since you had the colonoscopy?
Well, I had it about 3 years ago. I'm supposed to get it done next year again. It's been about 4 years, so I need to make sure that I don't have no type of positive cancer, you know, back there.
Yeah, you can check. Sometimes you can have internal hemorrhoids because using not empty completely, you can have the stool.
Exactly. That's another thing too. I want to check for hemorrhoids.
Was that a gastroenterologist?
Yes, sir. Yes, sir. I live in Virginia. I'm from Athens, Georgia, but my job is in Richmond, Virginia. I work with so far. I'm not gonna hold you. I'm doing this.
Yes, sir. I have desserts and ice cream down there, so don't have to worry about it. But there's other food in the food court. You sent this to you. Yes.
No, no. Hit the water over there. Oh, did you? Okay. I thought that was, you looked through the other ones away. The water.
I did.
Okay.
Look who's gonna be here.
Yeah. I would love to see him too. I would love to see him. Yeah, he told me. I talked to him before I left. When I came before, because I was telling him about my class union. And he wrote $2,500.
How much are they willing to spend on?
Well, put it this way. It's going to be $325 each person.
But how much, I mean, how much you gonna spend on the band?
I don't know, but we have enough money. Last time we were $290.
They probably pay $3,000.
Maybe we will have enough money if these schools come together,
Okay.
If we get 150 million, okay, $325, we bring the case in. Shit, it's gonna cost me $3,000, $3,600 rent the place.
Well, we still have plenty of money if you get 150 people.
Yes, I'm gonna buy a table for
Did they
dining.
get 150 people last time?
Yeah, well, close to it. Close to it. And then see now that we want our own bar.
Go figure, right?
We want our own catering. See now they can do the payment for us, the seller that the they didn't look them, but we don't want them. If we got a choice, they can do it or we can do it. But I'm gonna still take a couple bottles of wine, for my table. But yeah, I'm gonna buy 2 tables, one for me and for Diane. Yeah. So we'll leave. What time is it now?
It's 10 till 3.
Well, we'll leave here about 10 after, quarter after 3. Yeah, I still should give us enough time to get there. I'm gonna stay at home and rest too.
Okay,
So when I go back.
So, wait a minute, are you taking me to the doctor's appointment or going straight home?
We're going home.
We need to leave
Where's the doctor's appointment at?
It's in Covington, next door to the cancer center.
Oh, okay.
We get back. I guess if we get, it usually takes me 20 minutes to get over there.
Well, it depends on when we leave here, how much time. If there's enough time for me to take you back, because I'm gonna go back home and just relax. And eat that best beans and stuff I have there. So I can start putting stuff in the car, I guess, and try to get out here in the morning, I guess. Still have a couple pieces of fish in there. That tilapia was a big thing one time. We love tilapia up here. Hey ladies, how y'all doing? Yeah, that tilapia was a big thing in Virginia one time. They said sometimes we have mercury in it. I think we can take these up there. Take these phones.
Yeah, we can.
That's the communist thing. I like to come over here and check them out. They have now they have it on Sunday. Dan said he would love to come up. I said, I wish I was here. Wish I he said, yeah. And him and Stephanie would come up for that. They like it.
I like that too.
November 18th. You be in Let's start Friday. Let's start tomorrow. That's tomorrow. Where's it gonna be? I mean, it's gonna be outside or inside? Probably outside. I'm gonna find out. I'm gonna ask.
Probably outside. Because it says car show, trunk or treat. It's outside.
Okay. So John's 4 hours, third August.
I just don't like them outside at the evening because it's cold.
Well, maybe I love outside. You got the jacket on. You know, yeah, that's the best time to have them. When it's cold. Oh. I let their water in the seat over there.
What is it?
Take it now till they come back. Maybe think about when I met Philip Mars, we have all these classes. Oh, get a break. No question. And they would have a lot of stuff in front of them. Food and drinks and water. Oh yeah, love to snack on. But them class would last from 7 in the morning to 4 o'clock in the evening. No, you see what they're going to say? You know, people said that. Food is killing them. It damn near kill him. That's what he said. He said food is killing them. Yeah, Mary, I still call Mary to let her know about, because she said her friends dealing with it. Okay. Maybe they got a car. He have a car? Really?
He might not be available.
Okay.
He might not want to come.
Well, I would think that he would give you information about your prostate.
Yeah, he still might not want to come to this one.
Okay. Well, it's too late now anyway. You know. I don't know when we're going to have the next one. I don't know. I don't know when it's going to be. I'm sure it's going to no. I'm sure it's going to be another one. What's that that salt that she said you put into your oil? She says it's kind of hard to get sometimes.
Because of the propaganda. And that's how this country operates. It
So,
operates on propaganda.
damn young people on TikTok, they gonna try to tell you how to keep count and stuff.
Let me tell you. They have young people telling you how to do everything. And they don't know that.
No, it's down here.
They have people on there talking about they know how to trade on the stock market at 15 years old. How much experience do you possibly have if you're in 10th grade?
You know what? But they still connect with people though. You might be in the 10th grade, but you still got people calling, you know.
That's that's a trick to it. That's the trick.
Wow.
Still think of that damn snake, you know?
I know.
Yeah. That's incredible.
That thing is.
That's incredible. Yeah, you hear that thing could disappear that like that.
It was quick.
But I hit it, I read one further.
The first time we ran over, I didn't feel it. The second time I felt it.
And I was going fast too.
He said she's gonna be valid.
I later talked to
Oh, I didn't know that.
she didn't explain to me.
Right.
I told her I had to get back over there. I want to get the water. She said,
So you get on.
bring your wife back over here.
I've heard of it before. It's a senior center. It's a senior
Make sure I pay for the bed. Emergency card.
What I was gonna say was, that's why.
Yeah, I've seen this on TV. It's for senior citizens to come to medical.
Yeah, I'm not afraid of 10 odd times, really.
Oh.
So, boy, you got 0.1. I said, man, I thank God for my health. I thank God for my health. No doubt. I don't want a 3.5, 4.8. When you get ready, when you get that, you'll pretty soon funeral home come to get you. And you can get to a 4 something fine. You know, oh yeah, if you didn't go there, they're gonna take it out. Put it down, yeah. I still don't think my brother should have taken it out. I think he should have got more advice, more people, I really do. It was a setback too. Well, Diane said help me because the council, because, we got out of it. And she said that it was sex. She's 7 years old, so she don't think about that.
I don't think about it like I used to.
So she said that, so they just had to think, your friends got it now. You say so with your teammate.
With the medical, take an oil treatment. But you just have to get it.
But you feel with it. But that ain't gonna fit me.
Yes, it does. For the first 48 hours. Yes, it does. I said so. Explain to me too. What I tell you about the hospital? You were with us. Well, then you have to be trying to do that.
because we got he was a
Oh my
But yes,
I
it's
thought
not
the
over,
video.
but I'm taking the
It was so bad.
and that you still, it says that when you're taking hormone therapy, that it is best to still wear.
yeah, because I forgot, I didn't even tell him that my doctor, he said, yeah, Dr. Conrad said, that's release that semen. Okay, so you know, said they help me prostate. And he said, you, Jack, he used to ask me like that. He said, Mr. Walker, are you having sex with? I said, no, Doc, you know. He said, man, you better do something, you know. He had a lot of jokes. He had a lot of jokes. And then he explained to me, I said, why you? Let me show you something. He showed the fluid. He said, the fluid is clear. He said, either you masturbate, you find you a woman. He told me, he said, all these women here with me. I said, well, I don't have a relationship right now. I said, I said, I understand that. I said, I'm just going to do this with somebody else. Yeah. I said, yeah, there's a lot of women here with me everywhere. I understand that, baby. Listen. Listen, we didn't have sex a long time. We don't have it every day, every week, okay? We like them, you know, okay? But I'm not yes. I'm not there yet. Okay? And now, don't get me wrong, God, but when you start having the people, see, okay. No, listen what I'm saying. I'm saying that I know it's
Go ahead, what you say?
okay, what I'm saying, okay, yes, it's supposed to be married, but what I'm saying, we are not with this one and that woman, this and that woman, you know, with you, okay, and so, don't get me wrong, God, but when I start having the different women, yeah, he got problems with that. I'm not saying anything, I'm not saying that, okay, but, you know, like I said again, you know, I'm not, again, you know, I'm not a virgin and I'm not trying, you know, ain't no woman in this country, just no son, that, okay, some do and some don't. Okay. The main thing is, the main thing is finding a good man, a good woman. This lady told me, she said she gonna have sex. She said sometimes she get hungry. She said they're gonna be for a man that she really wants. And he's gonna, and not only that, he's gonna, you know, she said, 1,000 men. She said, but she knows that he'll her still going. And they randomly going out with somebody. And they told me up there. She met this man. He's got money, got a nice, big ass house. So when he did, he came to her house, pick her up, this is studio, we live in all that. You know. So she go to his house, and he's got an adjective, you know, just him. So she said, they went through the house, you know, and she said, he turned the music on or something, you know, and through the speakers or whatever. So she said that he offered some wine. She said, she was drinking wine there. So she said, okay, she heard the wine. She said, "Baby, you tried to pull my ass." You know, she said she didn't see that he did an erection for against her. And so he said, I don't want a woman to give me anything you see what I got here. She said, I said, but I just want a woman. Oh, you did? Intimate. So she thought that he was going to leave it alone, just, you know. She said, I kept words on, why don't you get in there with me? She said, made a love for her, you know. Been known for a week. Listen at me, baby. She didn't get it. Well, she, you know, it was during the day. Right, exactly. During the day. And so, but look. That's why she said she is drinking wine. Because, you know, and so, well, she already had called her girlfriend and let them know where she was at. She just didn't, you know. But I'm just saying, cool, I agree with you. But she said, you took her home and, no. She didn't want that. She said, you know, she said he's trying to impress her with this $600,000 house. He's trying to impress her with it.
The first time we ever saw
I'm talking to you first time. Right. And so I picked up the phone and called.
I'm watching the phone number.
Thank God that I had yours. They wasn't so look this way. We can't stay here all day.
Yeah, you know they get there anytime. So we might just have to be.
No, what time is it now? Well, we get here. Well, let's see.
We might just have to. You're not gonna be able to stay much longer.
It'd be nice. Yes, so you know, because we got our appointment, you know. Is that your key paper? Okay. Well, it'd be nice, man. You know, come on. They should have did that first.
They stopped at 2:30. They said 30 minutes, but you know, depending on your
Someone take this.
You said that. That's only from 12 to 2? Yeah. If they got someone who, now I come over here and they had some free things. But she was saying that, that they're selling copies, they have an entertainer or a band or something, there's a charge. This is usually about $20. That I come on. And you said it, one of my old cars. I'm not certain. Thank you. Is this for sale? Okay, wonderful. Yeah. Well, okay. So it was that was it was. Oh, I didn't know she was. I don't follow politics as much because I live in Salon. So she's before her term was up, and they appointed what's the this was after the Georgia legislature. So now he's first and he lost that. So, just curious, when you got there you go. So, what's the best chance of winning? What's the ratio? Oh, all right. Thank you. Nordic natural. This is my eye doctor. And the reason that he has me on official supplements is for my eye. Really? And it had that nice friends. Okay, so it's Nordic, I see. It's not cheap. And how much fix if I want to fix it? That's what you're asking. Oh, one of them. Oh, it's about like just $35. Okay. But it really helps. It makes a difference for me as far as my eyes. It doesn't matter if it doesn't feel like I always got something in my eye. Yes, I feel it. You get it. You could get it on.
All right. Are we ready to restart in just a moment? So we have something that's gonna, liven us up a little bit. We have some models in the room. Maybe we can get our DJ back there, /producer/director, Todd Rhodes, to, I don't know why I'm calling him Tom. It's Todd Rhodes, to strike up a little music for the Tom. Yeah, he cut my mic. He's gonna do some music for our models. I understand we have models here, survivors of breast cancer. And we want our models to come up and introduce yourself. Yes. We have breast cancer awareness model.
Good afternoon, everyone. Again, my name is Sylvia Dennis Ray. I am a caregiver, I am an advocate, and I am a breast cancer survivor.
My name is Shalala. I too am a breast cancer survivor. Two different types of breast cancer. A rare form of cancer disease, then one incision. Radiation treatment, cancer treatment.
Our next model.
I'm not a breast cancer survivor. I came here to support these patients. I'm very hungry.
Thank you, everybody.
And we have all of our survivors. All of the survivors. Can you just stand? Stand. We want to salute you. recognize you. Understand that, you know, cancer doesn't look a certain way, right? You're striving and surviving in the community, advocates and aspiration for other people to follow, right? That yes, I can live a healthy, productive life. So clap your hands. So next we are going to have is Miss Talonda Thomas. So you can come on up. So I have a question before she starts talking, just a little icebreaker. Is breast cancer or prostate cancer #1 cancer? Does anyone know the #1 cancer?
Skin cancer.
Skin cancer. Yes, did you know that? Skin cancer is the #1 cancer. So make sure you're taking care of your skin too, okay? Because health and wellness is important overall. At this time, Ms. Talonda Thomas.
Hi, good afternoon, everyone. My name is Talonda Thomas, as she said. Can everyone hear me?
No.
I can't hear myself. Can everyone hear me now? No. Third one's the charm. Can you hear me now? Can you hear me now? No. Can you hear me now? Okay. Can you hear me now? Okay. All right. Okay. Yes. Very good. Okay. Good afternoon, everyone. I am Talonda Thomas, as she said, and I am a 13-year cancer survivor. Yes. And I was diagnosed in 2009. I thank God every day, obviously. And I realized He left me here for a reason. I'm grateful, and I realized with everyone that was talking, there were just so many things that I heard that I was like, oh yeah, I was gonna say that, I was gonna say that. But I never smoked. I was a healthy eater. I wasn't a fast food eater. And I maintained a good weight. I didn't drink much. Actually, you can ask my husband, because I was a cheap date, right, babe? That's my husband right there. And basically, I felt like I did all the right things, you know? So I was living my life. And obviously, I'm sure with all of you, it just was not on my radar. And it was like a truck hit me. Because I also had no family members that had cancer, had breast cancer as well. Had no family members that were close in lineage that had cancer. So nothing was on my radar at all. So, let's see, I was 35 years old. And you didn't have to get a mammogram until you were 40. And I found it out myself. I wasn't doing my monthly self-checks, like you're supposed to, but this particular time, I happened to be doing a self-check and I found a lump. And I was like, is that what I think it is? But I didn't take any chances and I went to my primary care physician. And thankfully, when he felt the same thing that I felt, he was very diligent in taking the time and saying, he could have easily, like I've heard, unfortunately, so many other women say that they've had people, that their doctors didn't follow the signs because, oh, you're young. It may not be that, and then they find out later in the state they were much further along. But my doctor was diligent. He was very diligent, and he immediately had me go and get a mammogram. I mean, not a mammogram, I'm sorry. Get, not a biopsy, I'm sorry. Ultrasound. Sorry, so many tests. Ultrasound first, then the biopsy. And everything just happened so fast. And I didn't tell anyone at first. I was just like, oh, let me find out before I worry anyone. I didn't tell my husband. I didn't want to worry him. I only said, there's something, I'll let you know if something comes up. And he was like, what do you mean? I was like, well, just have to have some tests. I'll let you know what comes up. And all I did later was, after the biopsy, again, I went alone. Why did I do that? Why did I do that? And it was over the weekend, and Monday, I was at work and I got the call. A lab tech of all people. Very dryly said, Ms. Thomas, you have an invasive mammary carcinoma. Right, what's that? I was like, what's that? He said, oh, I'm sorry, you have breast cancer. Just like that, just like that. This is how fast executive I was silent. And he's still talking. So you need to do this, you need to do blah, 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 and call your primary care doctor, blah, 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 blah. That's all I heard was wah, 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 wah. By then, I had mentioned to my husband, there's something wrong. And then I left work, proceeded to go home, and when he got home, I told him the news. He made sure I never, ever gave up. And we went into fighting mode. I went through all the tests because, of course, it was invasive. I had to make sure, check it all my bones, all my organs, just everything to make sure it had not spread. It was very tedious, very long, agonizing. I had all these tests, thankfully it had not spread. In the meantime, I'm wondering again why. And I just wanted to get through this. It was more mechanical. It was more mechanical. It's important, like they said, to make sure you know your history. To make sure that you don't follow stigmas, because there was a lot of things going in my head about what my family was going to think, all of those things. Because I've had family members in the past, long when I was little, and I don't know if you guys remember how they would talk about the C word. And those things went through my head. I have the C word. And I said, I've got to put this in the past. I've got to be positive. That's not, this is something I have to put this behind, all that negativity behind me. This is 2000, that was 2009, not 19 whatever. Okay? And there was all this new medicine and things like that, so I need to forge ahead and not give up. People were asking me, are you okay? One thing I want to say that helps me a lot, and I know this helps you, and I tell anyone who do not have cancer, it is so important. Don't just ask, are you okay? Do something. Do something for someone when they're going through cancer. Send them a card with a gift card in it for groceries, or to go to the movies, or for dinner. Take them out to lunch. We all can do something more than just say, are you okay? Or when you say, what can I do? Or is there something I can do? Actually, go ahead and do it. I had a few angels, and that made all the difference. All the difference. We all handle our journey differently. That's another thing. Like you said, a lot of times people may look at you and they say, you don't look like you're sick. You must be doing better. You're doing great. Okay, you say so. But just take the time to do a little bit more behind the scenes, and just out of the kindness of your heart, just do a little bit to help. I want, because when someone is going through cancer, it can be hard to go through chemotherapy. I saw people sitting there, they didn't have family members there, maybe they lived out of state. Or maybe they didn't have a good relationship with their family members. And a lot of them caught the bus to their treatments. I talk to them all the time. They would go catching a bus. Offer to take them to their treatments. Offer to take them. Or pick them up. These things are just simple acts of kindness that when someone is going through the worst time they could possibly go through, needs someone else to take the time for them. I mentioned knowing about your history and your family. Going back a little bit. I make sure my daughter at the time when I was sick was only 4 years old. She didn't know what was really going on with mommy. And I remember she just recently graduated from high school, by the way. And I remember the first thing that I said when I got sick was, this was me, and I was telling my husband this just the other day. I said, this was me then. I was so emotional when she graduated because the first thing, I wouldn't get emotional. The first thing I said when I got sick was, God, I must be a lot stronger than I think I am. Because I don't know how I'm going to get through this. My grandmother used to always tell me, he doesn't give you more than you can bear. And I sat there and I thought about my daughter. And I said, I don't know if I'm going to even see her graduate from high school. My first day of going for all of my scans was her first day of pre-K. And I literally have a picture of me tying her shoes in her little pre-K uniform. And I remember that was the exact day I was going to get all my scans done. And I remember her walking across that stage and saying, how amazing it is that I'm standing here right now, that I was there to see her. Every one of us has a story. Every one of us has a testimony. I'm sharing with you mine. You've shared yours. Continue to walk in the light and the glory of what you have gone through. Because although it was hard, and we know that, it was for a reason. It was for a reason. So I make sure that I tell my daughter now about my illness because I was 35 when I got sick. She's 18 now. That means in a few years, when she's 25, she has to make sure she's going to the doctor to start being scanned for breast cancer. 10 years younger than me when I got diagnosed. That's how it works. That's why it's so important that you know about your family's history, that you know what went on with them, because your doctors need to know so that they can kind of keep that in the back of their mind. This is something I need to be looking out for, just in case. And her doctors need to know that. My cousins need to know, so they can tell their doctors. Your cousins need to know Your grandchildren need to know. Your sisters, your brothers. Yes, your brothers, your uncles. They all need to know that you had breast cancer so they can tell their doctors and they can put it on their charts. It's important. People forget that. I make sure that I do that for them. I'm like, you made sure you did that, right? Yes, I did. They make sure they get their scans. I have to make sure my grandmother as well. And she's getting her mammograms. So do your due diligence. Now that you have maybe gone through something that, yes, was very difficult, but you want to make sure that someone else has a chance and is not diagnosed late because they didn't find out early. I have a church member that, because I spoke at church, went and got her mammogram, had not ever gotten a mammogram. She was in her late 50s, early 60s, found out she had breast cancer. Was able to have it removed. She was in the early stages, had minimal treatment, and she's now cancer-free. So you can do that. Thank you.
Thank you so much. Thank you for sharing your story, empowering for others. We have one more speaker. Tim. He was one of our panelists earlier, Melaleuca. He's a senior director of Melaleuca, and he wanted to give some insight, and then we will wrap down. If you have any additional questions or comments that you'd like to share with the room, we can do so at this time. Mr. Tim Brown. Clap your hands for Tim.
Thank you, thank you.
Take us to the icebreaker real quick. That'll open up the conversation.
All right, thank you so much, Ty and Crystal and all the other panelists. So we have a question here. How many chemicals is the average person exposed to each day before leaving their home? And it says average person, but it's really the average female. Anybody have a good guess? How many chemicals is the average female exposed to each day before she leaves her home? Is it 50, 100, or 200? It's almost 200 different toxic chemicals that the average female is exposed to before she leaves the home. And so I'm looking in this room and I'm seeing, so many people that are cancer survivors, and, we've heard about, nutrition and seeing our doctors and all of those things, that's so important. Most people, when we're thinking about wellness, all we think about is, eating better, right? Or we think about exercising. But hardly anybody thinks about the toxic chemicals that we're breathing in on a daily basis or that we apply to our skin. For me, it's been a journey, because I never wanted to get cancer. I don't think anybody wants to get cancer, right? I don't think anybody does. My dad was diagnosed with prostate cancer. My uncle was diagnosed with prostate cancer. They dealt with those things. My dad actually passed away from the chemo and radiation from nose and throat cancer. Didn't smoke. But what was it? When we think about lung cancer, nose and throat cancer, we think about probably smoking, right? But nobody thinks about the bleach and ammonia that we use in our homes, that we're breathing in. But we know that it's toxic, right? Because when we go to clean our house, the kids have to leave the room, or you got to open the window. But so 25 years ago, guys, I personally was introduced to nutrition. And it was, you know, for me, as a college athlete, I was into taking care of my health, and nutrition was something that came along after I got through playing football, but it was because I wanted to keep my health right. I didn't want to be the person that walked around with, you know, the bag of prescription drugs, right? And so when we think about those things, what do? They tell us, you gotta exercise. That's the biggest thing, right? And we should. I still exercise. I'm 55. I still exercise. Then they say, okay, we gotta eat better. But I learned, guys, you know, growing up, my parents always had a garden. How many people grew up where, you know, your parents had their collard greens, their tomatoes, their peppers, I grew up like that. And I'm from the city in Michigan. You know, I'd be playing basketball and football, and I had to go and work in the garden. And all my friends, they were playing football and basketball. But those things stuck with me, right? I told earlier, my mom put wheat germ on our wheat cereals, and that's true. But I grew up with nutrition. I grew up like that. And so at 25, I was introduced to real multivitamins, guys, and I've been on multivitamins since I was 25 years old. That's 30 years. But that's what I learned. You know, and a lot of people don't know this, but I learned that the food that we eat, we can go to the grocery store, y'all. We go to the big box store, and we go get the vegetables, and we can go get the greens. But guess what? The way food is processed nowadays, there's nothing in it. So we want to take care of our health. Not only do we got to eat right, guys, we have to supplement. We got to get better quality supplements, right? So I've been on the supplements for 30 years. I was introduced to those things. But 5 years ago, I was introduced to this company called Melaleuca. I think I got it. After 25 years of taking better care of myself with exercise and multivitamins, I was introduced to this company called Melaleuca. And I go back, because I said no to this company 5 times. I've been a business owner for 25 years, most of it in wellness, because it's been a mission of mine to share with us, because we don't eat right? We don't take care of our health. We have more sickness and more illness in our community than anybody else. And a lot of times they say it's because of our race. But it's not always our race, y'all. It's how we eat. It's how we get the nutrition that we get, right? And so I've been on that wellness kick for so long to share. And 5 years ago, I said yes to this company. And I will tell all of you why. I'm a customer, number one. All those products y'all see over there, that's for my house. Nothing is for sale over there. Those are all things that I use in my house. It's about converting to safer products, right? So when I was introduced to that company, number one, I went looking for some great vitamins. And you can see Crystal back there, she has some great vitamins as well. But I saw that, okay, I'm a vitamin user. All of our vitamins are from organic sources. They're designed to reduce free radicals and inflammation in the body, which are 2 gateways to disease, to illness. So our vitamins, supplements, they're designed for that. I didn't want that. I didn't want cancer, right? And I'm so grateful for all the people here who are survivors. My dad passed away from it. So I said, okay, they got great vitamins. But not only that, laundry detergent. Guys, do you know how long it takes for a chemical that you put on your skin to get into your bloodstream? Anybody have an idea? 26 seconds. So when you're using your laundry detergent, when you're using your soap, when you're using your deodorant, when you're using your lotion, when you're putting all of the shampoo and the conditioner, the makeup and the skincare, when you're doing all of those things, 26 seconds for those toxic chemicals that are in those products to get inside your bloodstream, to start causing free radicals, to start causing inflammation, to start negatively affecting our health. None of our products have parabens, phthalates, no bleach, no ammonia, no phosphates, no formaldehyde. All of those things that have been linked to cancer, to other illnesses, Our products are amazing. Cleaning products, no bleach, no emollients. Skincare, got skincare. None of our skincare products have any of those toxic chemicals in them that have been linked to a lot of those illnesses and diseases. So when I saw these things, guys, it became a mission for me to share. 5 years, we share with thousands of people. We've helped thousands of families convert their home to safer products. I love it. It is a mission of mine because of the things that I'm hearing here, because of the things that
Bigger and better things next time. Here you go.
First of all, on behalf of the New Black Wall Street Market and the staff, I just want to say thank you all very much for coming out, spending your time. You could have been anywhere today. Could have been doing anything, learning anything, eating anything, all that. But you chose to come here, spend some time with us and get some quality information that can literally change your life. Thank you so much to the survivors who shared your testimonials. I know that's very personal, things that you all have been through, and I just really, from the bottom of my heart, appreciate it. Thank you all for coming out and sharing that stuff with us. As Crystal was saying, this is the first event like this that I've done, and it will not be the last. So if you signed up for our email list, if you signed in and you came in, I have your email addresses and where to contact you. So you will be contacted about future events like this. As you see, it's very powerful when we come together and we share our experiences and we share things that we've been through and are going through currently in real time, and it changes lives. So that's what I'm about. I'm about changing lives. I'm about transmitting good information to people. I just want to point this young man out right here. Just to raise your hand, sir. This gentleman is a prostate cancer survivor himself. And he works with an insurance company that specifically deals with cancer patients and people who are dealing with cancer. So be sure you connect with him before you leave, if that's a need that you have, or if you know someone else who may have that need. Definitely connect with this young man before you leave. But lastly, I just want to also say that if you have any organization that you are a member of, if you have other advocacy activities that you do, I am actively creating what we're going to be calling the New Black Wall Street Market Health Alliance, where we're going to be bringing different organizations together to fight different ailments, different cancers, different things that are affecting communities of color more than other communities. And just reach out to me if you are able to, and give me your information, and there will be more events like this coming, as well as more information about the Health Alliance, because we have 125,000 square feet here. We've got dozens and dozens of Black-owned businesses. We've got a sound stage, we've got a jazz club, we got a ballroom that you're in right now.
tons of unique and exclusive products you can't find anywhere else. So why would you want to go anywhere else and have an event than the new Black Wall Street Market? And yes, that's a rhetorical question. So again, thank you all very much. Really appreciate it. Thank you to everybody who helped here today. I want to thank my cameraman here. He did this out of the goodness of his heart because he relates to everything that we're doing here. Thank you to Brittany B in the back. She helped me out quite a bit today. Thank you to her as well. Thank you to all the presenters. Thank you, Crystal, for your work here today. And just wanted to say, God bless you. I love you all, and thank you so much for coming, and stay tuned. We got more to come. Thank you.